Hi there, Andrew with Zang Physical Therapy here. And what I want to talk about today is what PT, physical therapy, can do for you. So there are three big reasons that people seek out a physical therapist. Probably the number one reason that people come and or people associate with physical therapy is someone dealing with pain, be this from an acute injury, from surgery, maybe a car accident, a fall, you name it. Somebody has pain, they associate with that. The number two reason, and the thing that I like to think really drives it, is not just the pain, but what the pain is stopping you from doing. So in the case of, let's just say, a car accident, somebody has neck pain, but what is it stopping you from doing? Well, maybe it's turning your head to left to check your blind spot. Maybe it is sitting at a computer now and typing all day because you have to constantly kind of tip your head down, look at a paper, and then back to the computer screen. So maybe that's stopping you. Maybe it's impacting your ability to work out or to do home activities. So yes, you do have pain for some reason, but what is it stopping you from doing? So that is another big reason in what physical therapists do. We analyze the situation, we learn what you can't do, and find a way to help you do that again. And the third big thing that physical therapists can do is help prevent the loss of something. So let's say you're a middle-aged person in your 40s or 50s, maybe even 60s, and you look at your parents and you see that they're struggling to walk, they're struggling to go up and down stairs, they have difficulty getting up and down out of a chair, they don't want to go to the grocery store anymore because they struggle. So when you're young and still reasonably healthy, you want to say, I want to avoid whatever it is, teach me how to do that. And this is probably the number one thing that our profession doesn't do well enough, is educate people on how to prevent the loss of things, their mobility, their function, their independence with daily activities, ability to travel, whatever it is that you want to be able to do 20 years from now. What if you could learn how to maintain that function, maintain that ability that you want 20 years from now? It starts today. It doesn't start in 15 years when you start to notice you have problems, and then in 20 years when you're really struggling. It starts today. So what are you willing to do right now? Or let's put it this way. What do you want to do in 20 years from now in terms of activity? You want to hike? You want to maintain golf? You want to swim, play tennis? If you want to do that, it starts today, right now. What are you willing to do so that you can do that 20 years from now? If the answer is nothing, then don't be surprised if in 20 years you're not able to do what you want to do because you didn't take care of your machine, your body, now. So if you want to work on improving your strength, your flexibility, your agility, your balance, you want to prevent falls, you don't prevent falls after you had a fall. By then it's too late. Your system is so out of whack and deconditioned that it's going to be hard and you're going to fall again. It's not if, it's a matter of when. So you want to prevent that fall that puts you in the hospital and puts you in a wheelchair. Why don't you take steps to do it today, tomorrow? What is stopping you from improving your balance, improving your strength? The answer is really just you taking the time to do it. So I hope that for the people who are listening, you're somebody who is an active person and wants to stay active, wants to maintain that good feeling. So if it is, then let's start down that path. So real quick recap here. Why people come to PT. Number one is pain. People want to get out of pain. Number two, what is the pain stopping you from doing? That is what we're really good at, is trying to solve those problems and help you get out of pain and get back to doing what you want to do. And the third and final thing is helping you to maintain what you have and improve your ability so that you can do that years from now. So if any of these sound like you and sound like you're ready to take that action step so that you can get out of pain, do things better, and continue to do things years from now, then let's have a conversation. Put something in the chat box, give me an email, andrew@zangpt.com. But I'm here and waiting to answer your questions and to help guide you to what you want to do in the future. Have a nice day.